From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse Podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse Podcast. I'm Jason Tenori, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Yo, welcome back, Dental Lighthouse Podcast. Dr. Jason here. Super excited for this interview today. You're not going to be subjected to my universal, individualized ramblings. So thank God for that. On the podcast today, I have Dr. Taher Dhoon, a good friend of mine, fellow coach from DSI, someone that I've known for got to be close to 10 years now. And the reason that I wanted to bring him on is because he's a surgical stud. So we're going to talk a little bit about, best practices when it comes to that. But more importantly, and kind of selfishly, to be 100% honest with you, he runs Colorado Surgical Institute, which is a CE platform, CE Institute for docs that want to enhance their surgical skill set and wisdom and knowledge. And I've sent, 4 or 5 docs through some of his programs, and they come back fired up and just doing things that they weren't doing before. And I don't want to keep that a secret. I want to make sure that you guys are aware that stuff like that exists and what's it all about. So without further ado, Taher, how you doing, brother?
Doing good, man. Doing good. It's a scorcher here in Colorado today. But nonetheless, I'm trying to get some sunshine before the heat hits a max capacity.
And there you go. I see that you got the cover on. Yeah. I can definitely appreciate that. I complain all the time about living in upstate New York in the winter, and because it's cold. It's really, really cold. And then on days like today where it's like just about to touch 90, I find myself starting to complain. And then I'm like, you know what? Why am I complaining? So let's start from the beginning. Let's start about, how did you develop your own surgical skill set and knowledge base? And at what point were you motivated to start the Institute?
Yeah, I mean, it happened like really organically. And I think any true passion project, or at least if we're looking at like ratios and percentages, just happened because it's something that you love to do. And other people then just start to tell you how great it is. And then you start to just say, okay, well, why don't I start moving a little bit of my time into this and just exploring what's happening without a true purpose in mind. And so, I bought a practice in 2012, and somewhere around like 2014, people in the local community just regionally would come watch us do surgery. And at that point, I was just super honored at that point. It was just something where I was like, oh, okay, cool. I'm young. People care to hear what I have to say. And it was just like this new feeling. So I was like inviting everyone into my practice who wanted to learn, and just like, hey, bring some coffee, we'll talk shop, I'll show you the surgery, stuff like that. And then we started getting contracted to go to other places here in Colorado. Then we went to Summers' office in Avon and learned a lot about implementation of these programs in other people's offices and how to train their teams. Went out to Mark's offices in Arizona. We came out and visited the Finger Lakes area with you and your.
Yeah, you did,
dude. That was an epic trip. Super memorable, man. And we found out, okay, traveling with the equipment is tough because one of our iCams got sent to Florida, and we had to stagger and improvise how we're going to set up the surgeries. And then also we found out the airliners only insure your bags up to $3,500, and that iCam at the point was like $45,000, and I was like,
right.
Like I'm out $40,000 because my iCam's in Florida, and I don't know if I'm going to see this again. And then my wife and me talked, and I have 3 kids. They're 10, 7, and 5, and I was traveling a lot. I was working hard on the private practice. I would say my stress was spilling out a little bit into how I showed up as a father and a husband at home. And she had the conversation with me about like, look, I didn't sign up for a husband who travels all the time. And I took it to heart, as I do, anytime she has conversations with me that are serious. And so it was just one of those things is you just got to bet on yourself and the whole field of dreams. If you build it, they will come. So we built a 12,000 square foot facility in Greeley, Colorado. And in the beginning, I was like, man, I built this shit too big. Like I'm paying dollars on every square footage here. We're out of 6 ops in the beginning, and now I built a 16 op practice. We have one conference room that can hold 70 to 80 people, one that can hold 40 to 60 people. And I just didn't think we were going to sell it out. I just thought I built it too big. And now fast forward to today, max capacity through and through. We really do put on a good program. We really do provide a good experience for doctors. And my career is not what I thought it was going to be. It just kind of evolved into educator and teacher. If we take a step backwards, back when I was graduating high school, I told my parents I wanted to be a high school teacher. And, they were the traditional Indian parents, and they're like, no, go be a doctor, a lawyer, engineer, or what have you. And so, I pushed into dental school, did that whole route. But I think the beautiful thing of it all is I've, come full circle, and I just found my way back into teaching.
Yeah, no doubt. No doubt.
Yeah, so it's been a fun ride.
Two things that you said there that I just want to touch on. Actually, let's go 3 things. One, having a relationship with someone like your wife who can be candid and honest with you, what a blessing, right? As opposed to like taking that shit and just like pushing it down and developing resentment instead of coming open and being open and honest. So, man, what a blessing. Cause maybe that was a blind spot for you and you wouldn't have pivoted if she didn't get real with you. So, that's awesome. I love hearing stuff like that.
I appreciate that. What I will say is that has been an evolution in our relationship, as all relationships are. And, it takes a stubborn man to bang his head against the wall and a patient wife to watch him bang his head against the wall up and into the point he starts handing out suggestions and you start listening because you start to be convinced. And then you find out all this beautiful wisdom is sitting next to you every single day. And then I've just at least listened up and tapped into it a little sooner.
The second thing I'll say is, to your point, that trip that you brought your team up to the Finger Lakes, Taher brought, 10, 12 people. I don't even remember how many it was. And we shut down the office actually it was a Saturday, Sunday, if I remember right. And, we must've seen, I don't know, 20, 30 patients, and just doing full arches, and it was controlled chaos. And then the evening got away from us, got a little crazy. So that's for the X-rated version of the podcast. So we're not going to get into the details there, but the evening got away from us, but we rallied and we were able to deliver a lot of arches the following day. And third, I've been out to Bria. I've seen the facility. It's beautiful. And I just knew, even though it was early in the process for you, that you had built something so special that it's just a matter of time before it fills up. And I'm so happy for you that it has gone the way that it has.
Yeah, thank you.
So like I said in the intro, I've sent a bunch of my associates out to you, and I'm assuming, like, how do I say this? I know you're taking special care of me, Taher. Like, but that'll be our little secret. But I have to imagine that the people that you're seeing, you're treating everyone with the same love and education and wisdom that you're treating my associates. So I only have my examples to pull from, but what makes your situation different? Why are my associates coming back, no matter who their mentor is, no matter what cases they're doing, everything from wisdom teeth to internal sinus bumps to, pterygoids? Like, what makes your experience different?
Yeah, that's a loaded question. With humility, I'll do the humble brag now. As you were asking the question, I mean, the thing that pops into my head is, and I've taken a dive into philosophy over the past couple of years, is that the man who understands peace truly is the one who was subjected to violence. And so the person as myself who understands education really well is because I paid top dollar when I was younger and had really bad experiences. And so when I was in the Dominican Republic, there were cases where we're doing panos. It was a German implant company back in like 2012. And it was all about the number. I mean, these were really shitty implants. The patients weren't treatment planned properly. They didn't have soap. He just poured alcohol on my hands when I asked for soap in between patients. It was just this ragtag operation. And there would be places where you could put 2 implants and they asked you to put 4 in there. And you just knew these patients were getting taken care of. Like the follow-up was just bad. And then now that I'm in education, I understand like the politics behind it. You got the Dominican Republic coming in and asking other organizations to come in and actually fix what's been done to the local population because it's been just so exploited. And then so I was like, okay, I'm a young dentist. I don't have money. I'm still paying my student loans. I'm trying to start a new family. And I believe enough in the skill set that I'm trying to acquire that I can have for the rest of my life, basically like compounding interest on my revenue, where I'm willing to spend dollars. And then as someone who's in education, it's an absolute responsibility to honor that for established dentists or younger dentists and take that commitment that they're going to, put in your organization and take it seriously. And so I think what we do is we'll do private calls with the dentists, and I'll just figure out like what's going on in their world. We have some dentists who are pretty experienced and they just want to work on efficiency or case acceptance. And so I'll be in the operatory and I'll just take a picture of their posture and show them like, hey, like you look at your ergonomics, man, like you're going to throw your shoulder out, you're going to throw your back out. We're going to look at their lighting, their suture timing. And then I'm just going to be really regimented with them about how they can do these procedures from 1 hour into half an hour or from 4 hours into 2 hours. And then teach them like subtleties and nuances that have made the success in my practice and with my patients a little higher. And then we also have docs who come in who are younger, and we do a lot of pre-calls with them. And what I find resoundingly in them is that there's a lack of confidence. And it's not because they're timid and it's not because they're scared. It's because via the Hippocratic oath of doing no harm, they actually care so deeply about the patients in the community that they'd rather not do it than actually attempt to do it because they're worried about the learning curve and what's going to happen to those patients in the learning curve. And so what we're able to do is really set up a lot of cases for them where I sequentially introduce them to harder cases throughout the weekend based on the conversation we have. So if there's someone who's coming in who's a newbie, I find a patient with 1.5 miles of bone and I build their confidence slowly through the first day. And then I start throwing harder cases at them through the weekend. And then the last case I like to give most people, if I can time it right, is a case that's probably one they want to refer. And so I get to show them kind of where they should refer because specialists do exist for a reason. And then to set them up for success. And then when they go home, we do coaching calls with them and they can text me their cases day and night. I review cases with them. I tell them, hey, this case is easy for these reasons. This is moderate for these reasons. This is difficult. Maybe we should refer this one. And when they have initial success early on, it builds their confidence, their team's confidence, the community's confidence in that doctor. And then those are the ones who tend to have a better experience versus the cavalier docs who maybe come out and have a lot of failure in the beginning because they chose cases that were too hard. And then they're just like, oh, this is not for me. I can't handle that level of stress. Well, it's stress they never needed to really encounter.
Yeah, so well said. I'm curious, one of the hardest things I find in leadership is I feel like I'm a good leader, and the people that I work with, I feel like I can lead them well, like the people that directly report to me. So I'm sure that when you started out and it was you as the primary instructor, it was awesome to control the quality, the experience from a mentor to a mentee perspective. And as CSI has grown, and as you've brought in more instructors, more mentors, and like I said at the beginning, my associates have been exposed to multiple mentors of yours and continue to rave about their experience. What have you done to not necessarily, micromanage these mentors and put them in a box and say it has to be done this way, but kind of developed a system where you're giving them a little bit of freedom and autonomy, but they're still teaching things the way that you want them to be taught?
Yeah, that's a really great question. I mean, I think it's almost, and again, these mentors are colleagues. And so it's not really like hiring, but at the same time, when we look at our organization as GPs and we bring people on board, I remember I was at a conference, I had a couple beers in me and someone asked me this question about, how do I pick my surgical assistant? Who do I figure out who I elevate? And then just very reflexively, what came out in that conversation was like, just someone you want to be around, someone you care to spend a lot of time with, because in the operatory, you're with them a lot, and just you want to be around someone who you actually enjoy. And then so we fast forward and dovetail that into the mentors. It's like, okay, well, who are people who people naturally gravitate to, where being around them is a welcoming feeling. It's like, oh, you can feel it, when you're around
Yeah,
someone
no
who
doubt.
wants you to be there, who like cares about teaching, versus someone who's like, hey, I'm just clocking in, clocking out, and I'm here for bravado and ego. And so we have an organization of very highly skilled surgeons, but at the same time, it's that bravado and ego that I think is repulsive and that I naturally recoil from when I get into the surgical spaces, that we've been intentional about creating people who don't have that. And so there are some really good surgeons who wanted to be mentors that just don't have a place in this organization. And it's not because they're not good educators or teachers. It's just a frequency that we all kind of harmonize to, where we're all, singing the same tune essentially. And then when it comes to protocols, me and Dr. Brisky do have our protocols. We do have the way we teach certain drilling protocols that have led to a safer outcome across the board. So if we look at it now objectively, there are ways to drill where you can protect a patient and your licensure better, and it takes maybe 5 extra seconds. So if we can teach people the nuances objectively of how to remain safe, the mentors follow the protocols that we set in place too.
It's awesome. Yeah. And like I said, you've picked wisely. It's been a really good experience for my associates. One of the things that my associates and I are constantly having conversations about when it comes to not necessarily just surgical based CE, but all CE, is the value of bringing your chairside assistant or assistants, right? We've all run into these situations where we take a 3-day weekend course, we come back super fired up, but we took it in isolation and it's just impossible to motivate the rest of the team to get on board. Or you're playing like telephone, trying to communicate everything that you've learned, and you're doing a horrible job at it, and you never really gain momentum. I'd love to hear your thoughts on, in general, CE, but specifically to what you're doing at CSI. How much value do you find in the after success, for lack of a better term, when a student brings a support member?
Yeah, it's critical, man. Like, this is not an individual sport. This is not like individual swimming or fencing. Like, this is a team sport through and through. And then if like we equate it to, the Bulls in the 90s or the Lakers in the 2000s, I mean, Phil Jackson and his triangle offense, it took three people. It took three people to get championships all the time. And so I kind of silo it into, okay, the clinician needs to have clinical skills that you can do the procedure that you tell the patient you can do at a high level. Okay, check. And then you need support team on the clinical side to support all the things preoperative in the surgery and then postoperatively. And then you need administrative team that can lock all this stuff in. And if you have all of those systems in place, success rates are through the roof. So then if we look at the clinical team members, like what are we actually doing with them? Well, we're going to teach them phlebotomy. We're going to teach them PRF. We're going to teach them the setups and things that they need to order. Part of my job, but not the main focus of my job at these courses, is to also inspire the dental assistants and show them what is capable. And I know when I went to my zygo training, 5-6 years ago, I didn't do zygomas for 2 years, but at the same time, I saw stuff where I was like, wow, generalists are doing this. Okay. And it just changed my mind about what was possible that a generalist could do. And so when the dental assistants come in, they see all the other dental assistants. Some of them are highly, highly talented and skilled, and other ones are pretty green around the ears and really like rookies with the potential to be pros. And so they get to see other people doing amazing things. And they're like, okay, I can do that. It just dispels myths in their own minds about what they are capable of doing and what they aren't capable of doing. And then also it helps the dentist trust them as well, because then they see another GP trusting their dental assistant with 10 times more than they get to do in their private practice. So it's a good back and forth that occurs between the dentist and their team member. And then, of course, when you immerse yourself into anything over a weekend with anyone, there's an absolute buy-in that occurs. versus just transmitting knowledge via a PowerPoint or a conversation. It's transmitting understanding that happens in the surgery with muscle memory, where like the body keeps the score. It's like I think the word for it is like gnosis, like the body has an understanding as well. And that's why I think the dental assistants coming in to live patient training also does significantly change the trajectory of their careers too.
That's so awesome to hear. You'd mentioned the administrative part, and I apologize for my ignorance here. Is there a course or a component where you're educating an administrative team member, a TC, or someone like that that's talking about financial presentation? Or are you just sharing that, like, obviously that's part of the triangle of, surgeon, surgical assistant, TC?
It's part of the triangle. We had a company called All On Marketing where the treatment coordinators could come and get training. What we do now is we're really focused into the clinical component of it all and then training those clinical team members. We do have a lot of resources for people to get that education. And then, of course, if you're alumni of CSI, like we send you all our consent forms, we send you all the marketing materials we've created so you can take it and run with it. And then our team is happy to do phone calls and more private type of conversations with your treatment coordinators and financial team members. But we don't have a specific program that lays that all out because there are a lot of good programs out there in the industry already.
Yeah, no doubt. Do you find that when green associates come out with no surgical experience, that they're not getting the value or their experience that they need versus someone that's maybe placed a couple implants or made a few mistakes or attempted a couple wisdom teeth cases? Like, what is your ideal, like if you were going to interview students to come take your course and you want them to have the best experience ever, how much surgical experience, if any, do they need to ideally have before walking into CSI and actually taking a ton from it?
Yeah, I think it's based on personality traits. So you have the younger doc who comes out, who's more of that gunslinger, if you will. And I'll use that in a positive connotation over here. Like they just have more confidence and less fear. Or for whatever reason, they have something in them that allows them to overcome it and then call it, confidence and bravado, however they want to package it up. They're ready to dive right into it. Because what their hands need is they need reps. They need reps to secure like the outcome to the confidence that exists within them already. And then we have docs who come in and they're a little bit timid and they're a little bit more of that analysis via paralysis. They read a lot. They want to understand like the osteoclast and osteoblast and the cascade and all the technical things that go into something before they actually take it to a human being, which is, a very admirable quality as well. Sometimes they're their own worst, well, we're all our own worst enemy, but at the same time, they're their own worst enemy when it comes to starting something. So for them, I also like them coming to the course so then they can get the process moving and we can start to build a little bit of momentum for them. But I set up different cases for each person. And then we also set them up with different mentors who have skill sets in fostering and helping really propel that personality trait forward. So there's a lot of thought that goes into it, but I would just generally say as a rule of thumb, if you want to do surgery and you actually like it, then start. Just take one step in the right direction, even if it takes you 5 years to create that program, versus someone who goes somewhere and it takes them a month. It doesn't matter one way or the other. You just got to start if you actually want to do it. And if you don't want to do surgery and you want to do cosmetics, like, hey, more power to you too. Like, I mean, there's so many avenues that being a generalist will take you. So anyone can get started. Just don't sit on the sidelines. That's all I would say.
Yeah. Great advice. Great advice. Let's close the podcast interview with, I'm curious to hear your thoughts on the technology evolution when it comes to implants. You know, I'm older than you, much older than you. So I remember a lot of the full arches that I was doing after I went to Mish, for what seems like forever. And, it was a lot of, the plaster block verification jigs and, cement retained over prepped abutments. And then it turned into, photogrammetry. And now even internally, we're doing a lot of facially generated treatment planning with 3D renditions of the patient's face. And it's just amazing how we're able to nail the aesthetics and how things are falling into place based on the technology. So is the technology, has it peaked, or is it getting even better? And what are you envisioning that this looks like over the next year or so?
Yeah. Ooh. Dr. Brisky is definitely way more technologically savvy, but I'll take a stab at this one.
Right.
For the single implant docs, I think generally speaking, we are at a plateau point for a little bit where it comes to place an implant in a very effective way, understanding your case planning, who you choose to do work on in the beginning and who you choose to refer. And then when it comes to the technology with scanning and getting your screw retained abutment and crown or angle screw channel or your zero bone loss concepts or all of that, I think it's relatively straightforward. When you get into full arch, I think the technological curve is parabolic. And so then we have photogrammetry, 3D printers, the mills that come on board. There's a lot of companies coming out with $3,000 versions of their own. There's not photogrammetry, but they get pretty darn close with just traditional scanners like a Trios. And so the economies of scale that are coming through technology right now are driving all the price points down. And the amount of labs coming on board with milling at reduced rates, because at that point, it's just a commodity. A lot of people think dentistry is a commodity, but both me and you know that that's not true. And then when it comes to labs, to some degree, it is a commodity in the full arch space because technology with AI and digital programmers and how much is getting outsourced to unqualified people in third party or third world countries. There's a lot of price reduction happening across the board, where you can get into full arch and then having a conversation with Dr. Brisky or myself about what technology to sequentially invest into. So that way you just don't break the bank, because we both know, I have 3D printers that are collecting dust because they're not supported anymore. The Einsteins are no longer getting supported with their resin tanks. So it's really figuring out to make sure you invest in a product and a company that's going to be around for a long time. And then also understand, you don't need to buy a lot of expensive things now to get into full arch. There are so many tips and tricks along the way to allow you to create the program, stack revenue and profit. And then what I would recommend is take 10% of that actual revenue and put it into an account you don't touch that has a higher interest rate associated with it. And when the account hits 10 or 20 grand or 30 grand, whatever your number is, then start to withdraw from that. So then you're paying for your future CE or your equipment or your CapEx, whatever the case may be, with the profit and revenue from the procedure that you invested in. And that way your P&L and your balance sheet stay relatively stable through all of it. Because I know when I started, my P&L was like a roller coaster. And it was freaking me out because I was investing so much into it and I didn't know where to go. And I just, was burning cash to figure out the path of least resistance. And you just don't have to do that anymore. There's the access to knowledge is there. It's just really picking the right person who will take the time to understand your unique situation where they can advise you more appropriately.
Yeah, great advice. Awesome advice. Well, I so appreciate the time, Taher, and your wisdom, and I learned a lot, and hopefully our listeners learned a lot. What is the best way if there's a doc out there that wants to learn a little bit more about what you guys are doing at CSI? Best way to touch base with you, maybe get on a discovery call, or just learn more about the courses that you have to offer.
Yeah, if you want just the regular routine, go to www.coloradosurgicalinstitute.com. But quite frankly, this is a mom and pop company, and I really intend to keep it that way until I'm an old man on my cane and walker. So what I would say is just text me. I like talking to people. I really do like talking to the alumni and people interested in this stuff. So, or call me, however you like to communicate. So my number is 858-692-3533. I'm Mountain Standard Time for the East Coasters. So, I'm usually up at 4 or 5, but that's my morning routine time. So call me at 8 or text me at 8 or 9, and I'm always here to help.
Thank you so much for the time. Ladies and gentlemen, Dr. Taher Dhoon.
Thank you. That wraps up another episode of the Dental Lighthouse Podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tenori, your host. Thank you for listening to the Dental Lighthouse Podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.